Welcome back to another wonderful episode of Caregiver College series. My name is Henrietta Ama, and I have the pleasure to host today's episode with my colleague Maison Field. So today we have Josh Hardin, who is a pharmacist with Mills Pharmacy. So welcome, Josh, and thank you so much for joining us today.
Thanks for having me.
So Josh, before we start, can you tell us a little bit about yourself and the wonderful work you are doing at Mills Pharmacies?
So I'm a pharmacist and one of the owners of Mills Pharmacy. We've got 13 locations that are primarily around Jefferson County, but we've got one in Greene County, one in Tuscaloosa County. And so we just try to be a really patient-focused business. We try to focus on prioritizing service and care. And several years ago, one of the sort of new directions that we took was we began to focus on offering, I guess technically it's called compliance packaging, where it's like a box of your pills. Instead of getting a half dozen bottles, you get a box that just has a photograph of the pills on the outside with the directions, and then individual packets that are labeled by date and time. So it makes it as easy as possible for the patients themselves or for caregivers to ensure that they're taking the right medicine at the right time, or to remember that they've taken their medicine, or to see that they've forgotten their medicine. So it just simplifies the process a lot. We had a lot of people who were spending a couple of hours a day filling up pill planners, or they were filling up pill planners for their parents or for their grandparents or that sort of thing. And we got a lot of positive feedback from the folks who decided to use it. I have this is an example. So it's just a box with a roll of packs that will have the date and the time printed on each individual packet.
This is so wonderful. We get a lot of concerns from caregivers about where to find medications, and it's kind of like frustrating to them. So we are very glad of the wonderful work you guys are doing. And the programs, the packaging, everything is so simple, and it makes life very easy for caregivers because they have a lot going on, and most of them are caring for other adults and caring for children at the same time. They have to go to work, they have to do so many things. So if things are kind of like working in a very easy way for them, it's like they feel like in heaven. So thank you. I think this will lead me into my next question.
Maybe just a little piece of it.
Right. So do you deliver these medications to them, or they have to come to the pharmacies and get them?
Often they're within a certain radius of our locations. We deliver.
Okay.
We deliver usually within, depending on the area, within 3 to 5 miles. We make some exceptions here and there, but we do deliver to the folks who can't manage to get out. I think we have a total of, I believe, company-wide, we have 765 people who are using this service. And probably, if I had to guess, I'd say somewhere between 15 and 20% of that is patients to whom we're delivering the medicine. But oftentimes they'll just have a caregiver come by and pick it up. Since the packaging is specific to date and time, we'll package it ahead of time so that the patient has it in their hands before they need to begin the packaging. So a lot of times, if they've got a caregiver, or if they're just taking care of it themselves, they've got a window of several days to pick it up at the location. So some choose to do it that way. Some ask us to deliver. We just try to accommodate the patient however we can.
That's awesome. That's awesome. So going back to what you said earlier, I know you talked about the labels and everything and how that can help, caregivers identify what kind of medication this is and all of that. I want you to go a little bit more deeper into the labeling. So how that helps people to identify, the kind of what they should take in the morning and what they should take in the evening, like what goes into the label. Is it readable? Is it more Is it very simple for people to understand that? And do you even have, labels in other languages, or it's just in English?
We do provide labels in Spanish.
Oh.
We haven't seen any demand thus far outside of just English and Spanish. But the labeling on the packages is actually, it's really labeled two different ways. So there's a label on the outside of the box that tells all of the medicines that are contained in the box. That has an image of each dosage form, whether it's a capsule or a tablet. So it might say, for example, lisinopril 10 milligram, take one every morning. So it'll have the directions like they would normally appear on a prescription label. And then next to it, we'll have a photograph of that dosage form. So that way, if the patient is a little confused and they want to verify, okay, this package has got my lisinopril 10, well, what's that look like? So they can look at the outside of the packaging and tell that they've got the correct drug in there. And then on the individual packets, there's thermally printed labeling that has the patient's name. On each individual packet, it has the patient's name, the date, the time of administration, and then an indication as to the drugs contained in that packet and the quantity of each. The complete directions don't show up there, since it's saying, hey, this is the date and time, take these tablets or these capsules. But they do have that labeling in addition to the outside of the package, so that they can verify for themselves that, okay, this is correct, this is what this package says. And then, of course, we encourage patients, if they have any doubt, or if they think that something is incorrect, or if they think that something's missing from a packet, or something is extra in the packet, that they call our pharmacy. And we actually have software that assists our pharmacists in verifying the packages before we dispense them, that stores an image of each individual packet. So if, we got a patient, say his name is Bob Smith, and Bob calls and says, hey, on my packet for, Wednesday, July 27th in the morning, I think this is missing. And so our pharmacist can actually pull up an image that is stored in our system to look at what the patient is looking at, to help verify that.
This is wonderful. Yeah.
It's correct.
Yeah. Yeah. This is so great. This is so great.
Sometimes technology is good for something. Once in a while.
Yeah. Yeah. So how is refills also, how does that looks like?
So since we have to synchronize all of the patient's maintenance meds to offer the program, we will know on a 30-day supply for a patient. We'll usually have reminders set up in our system about 7 days ahead. On a 90-day supply, that'll be anywhere from 10 to 14 days ahead of time. So our pharmacy staff will see a reminder saying, okay, Bob Smith's medicine is due. He's due to start taking his next box of tablets on August 1st. So somewhere around the 24th or 25th of July, they'll see a notice that says, okay, call Bob. And so we call the patient. We ask if there are any changes from the previous fill. We generally take that opportunity to ask them if they have any questions about the medicine, if they're having any issues with the medicines, like side effects or other problems, if the doctor has recommended any changes. So we verify that everything's correct. And then once we know what the correct list for the upcoming fill is, then we will ensure that we have enough refills. Go ahead and call the prescriber if we need to. And then we'll set another reminder to go ahead and run the insurance claims on those, which prompts our system to order the drug. So that way we make sure that we have the drug in well ahead of time. And then depending on how that gets into the patient's hands, whether we're delivering it from a location or they're picking it up, we'll send it via company courier. And then once, let's say that if it arrives at one of our locations and they're supposed to pick it up there, then that location will call them and let them know, hey, your medicine just arrived, it's here for pickup, and you need to pick it up before your start date of August 1st. So we try to be pretty proactive. It's one that sort of functions as a reminder to keep the patient, to sort of keep the patient taking the meds correctly, particularly important meds like ACE inhibitors, ARBs, anti-diabetic meds, statins, the ones that are really the most important for preventing long-term complications. But it also helps us to operate more efficiently. So it's really sort of a win-win situation.
Yeah, I love reminders. Email reminders and text message reminders. I love them. So that is really, really cool.
But yeah, if y'all need any other information from me or anything like that too, just you can email me or call me. I think my office number should be on the on my email signature. So if y'all, or I can give it to you if you need it.
Yeah. Yeah.
Okay. My office number is 205-871-9007. And then I'm option 6 when the robo attendant answers. But yeah, anything else we can do for y'all, just let us know.
Okay.
Thank you.
Last question before you go. Do you have any last advice for, caregivers or people seeking medication, anything?
Probably the best advice I could give someone who is a caregiver for a person who is having to take prescription medicines is find a pharmacist who will take good care of you. There are, it's hard to throw out a company name and say, go to this business or go to that business, and they're going to take the best care of you. I'm partial to independent pharmacy because independent pharmacies generally focus on service, but primarily develop a relationship with the pharmacist who is going to be dispensing that medicine, and then use that pharmacist as a resource. Ask questions. If there are no stupid questions.
Yeah. Thank you so much. Thank you for your time and everything.
Thank y'all. Y'all have a good week.
Y'all have a good day. Thank you.
Yep.
I appreciate it. Bye-bye.
Bye.
Bye.